Okay, so a quick video how to use the Mounjaro kwikpen. This is a UK version. I'm on 7.5. Obviously, you don't start on 7.5. You normally go up in increments of 2.5. For example, you start at 2.5 as a suppression dose, goes up to a 5, 7.5, so onwards in 2.5 intervals, up to a maximum of 15. Comes in a package like this. Obviously, mine is prescribed to me because my BMI is just over 30. I've been on it for 3 months now. This is my fourth pen. Yeah, so it's come up to 4 months. I'm planning on stopping shortly, but I'm nearly there. But you know, I'm going to carry on while I've got it. So comes with the actual needle points and some alcohol wipes. This is your standard pen. Just let it focus. So I'm drawing a kwikpen 7.5, as you can see. Sliding down at the back. Pen lid. Okay, so what do you get and how do you do it? First of all, check the liquid is clear. No air bubbles obvious present. You can just give it a tap and squirt the air bubble out. But anyway, we'll go from there. We'll go for that piece. So first of all, get your alcohol wipe and one needle, which is a 4mm needle, tiny. You don't even feel it. This needle, alcohol wipe. So first of all, what you do first, take your alcohol wipe out. Get your pen, just wipe the top, make sure it's nice and clean. Remember, hygiene is paramount with this, so don't touch it afterwards. It says me with paint all over my hands, but I assure you it is just paint. Okay, so that's that bit clean. While you're at it, choose your area you're injecting. Now, normally what they say is go one area at 1, 2, 3, 4 in a clockwise motion. About 3 fingers away from your belly button. So today I'm going to do this side. So I'll give the area a quick wipe. I like to go right over the area just in case I hit a different part. Now, remove the needle, like so. Just pops on like that. Screws on. One cap off. Then you've got another cap just underneath. 2 cap off, and then you need these 3. Now this is the important part. You look at the needle. You can see I've got a little dial. Just get that into focus there. Okay, wind it back about 2 clicks. And what you're looking for is, see, I never got any. So wind it back another 2 clicks. You're looking for some liquid to come out the end of the needle. Make sure it's clear. Yeah, a little bit came out. I'm going to give it one more little click. There you go. I've got a bit of a squirt out of it. That's what I'm looking for. Now I've done that, you're going for 1 full dose, which is what this pen is designed for, which is all the way back. It seems a long way, but that is perfectly normal. Now you've done that, back to your injection site, and in, and then slowly push in, nice and slowly, no rush, all the way close to the very end. Now count to 10 once you've got it in, because the liquid can still come out and you want it all to go in. Okay, I'm happy with that. Now straight out. That's it basically. Put your protection lid back on first of all, don't cut yourself. That lid back on, unscrews. That then goes in to your sharp spin. Don't put in your normal bin, guys. Into the bin like so. All your other bits can go in there as well. Personally, you can see that I've gone through 1 dose on that one, and I've got 3 left. Lid back on. Keep it in the fridge. You don't have to keep them in the fridge apparently, but personally, it's like food. Keep it in the fridge, keeps it fresh. Hope that's helpful to some people. Okay, thanks. Enjoy the journey.